Hi all, my name is Yuslikha. I'm studying majoring in pharmacy at Duta Bangsa University Surakarta. This time I will share a little knowledge about drug dosage. I choose this topic because many people don't know and understand what drug dosage is. Most people do not pay attention to the rules for taking medication properly, and that can have a bad impact on health. This topic must be known by many people so that later people will not be careless in taking medicine and take medicine according to the rules. Taking medication is a way that can be used as a treatment step to overcome health problems. Medication consumption must be carried out in accordance with the instruction and direction of the doctor conducting the examination. Comply with the advice given by your doctor to use medication to avoid the risk of using medication that is not in accordance with the dosage. The dose or number of doses of a drug is amount of a drug that can be used or given to a patient, whether for internal or external drugs. Unless otherwise stated, those are the maximum adult dose for oral, subcutaneous, and rectal injection. Apart from that, it is also known as general dosage. In the third edition of the Indonesian Pharmacopoeia, the usual dosage for adults and infants or children is listed, which is a non-binding guideline dosage. Each drug has its own dosage rules. The healing effect that arises from drugs can vary due to their individual nature. If type A medication with dose C is effective for patient E, then the same thing may not necessarily apply to patient D. This could be because everyone's body condition is not the same. The same dose will not be given to young pediatric and adult patients or between adults and elderly people. Then, if the patient's condition is serious enough, the drug dose may be increased to a higher level than other patients. Medication dosage also vary. In a certain concentration range, drug can provide effect and properties to the body. In a certain concentration, the drug consumed will dissolve in the blood. The speed of drug concentration also varies. If the rate of decrease in blood concentration of the drug is rapid, then the drug should be taken more often. Therefore, some medicines are taken 3 times, some are enough once a day. So, the dose given can differ between patients due to factors in the patient's body, namely age, gender, or body size, as well as the factor of the drug itself, how fast the concentration will dissolve, and the right level so that it can have an effect. We need to be careful when consuming medicine. If you feel that the medication that has been recommended is not effective enough, then you should not increase to the dose just based on your estimates. Try consulting your doctor and pharmacist first. Apart from that, do not take certain drugs for a long period of time because it can cause tolerance effect. An example is a type of sedative. As a result, the body may become tolerant to the previous dose and require a higher dose. This can make the body dependent. General Professions of Pharmacopoeia Indonesian 3 about dosage. Drug doses are based on the dose used. 1. The therapeutic dose of udonlazine is the dose given in a situation and can cure. The long dose of a drug can be found as the amount that can be expected to reflect the effect on the treatment of adults in accordance with the symptoms. The usual dose range of a drug shows the range of power or amount of the drug that can be used, determined within the framework of biomedicine practice. For medicines that may be used by children, the dose is reduced and the dose. 2. The maximum dose is the large dose that can be given to adults for one-time use without harm. The maximum dose is a dose that must be completely. Little dose 50 is the dose that causes death in 50% of experimental animals. 3. For little dose 100 is the dose that causes death in 100% of experimental animals. 5. Toxic dose is the amount of drug administration that can cause poisoning but does not cause death. 6. Post anergia. Even a prescription, there are 2 or more medical ingredients that contain DM and have the same effect, then the combined DM cannot be more than 1. The purpose of calculating drug dosage is so that the patient gets the drug according to what the patient needs, either based on their own wishes or based on their wish. It is determined by the doctor that a prescription is required if the medication must be prescribed by a doctor. Factors that influence drug dosage. Choosing and determining the dose is not easy because you have to pay attention to the following factors, including 1. Patient factor. Patient factors include age, weight, gender, body surface area, tolerance, habituation, addiction, and sensitivity, as well as the patient condition. 2. Disease factor. Disease factors include the nature and type of disease as well as cause of disease. 3. Drug factor. Drug factors include the chemical and physical properties of the drug, pharmacokinetic properties, and type of medication. So, why we have to take medication according to the dosage? So, if we experience an overdose, this will be dangerous for the body. Taking medication not in accordance with the dosage causes disturbance in vital signs in the body. For example, body temperature, pulse rate, respiratory system, and blood pressure. Don't forget to follow the doctor's instruction and suggestion as stated on the medicine when taking any type of medicine. There is no harm in providing information to your doctor about the medication you previously took. Do not combine medication without any information from your doctor. Okay, that's all I can share this time. Hopefully, it will be useful for everyone. Thank you.